be people. I don't know. Anyways, if you want to know more about pain, injury, you're at the right place because I'm going to share a few things that matter when a person is injured. First thing first, my name is Dr. Deria and I'm working at Fitnet. I'm working at Fitnet for last 8 years and we are growing it and we are growing it at a pace which is comfortable to us as of now. And over a period of time, Fitnet is going to be huge. Fitnet is going to help everyone who is having pain and injuries. But not now. Right now, I'm just focusing on one thing at a time. I'm trying to build up my life. Because one rule I know about entrepreneurship or building companies is you have to secure your family first. Secure them financially and socially. Once your family is secured, then you can take risk by building a company. That is one thing for sure. Anyways, so I have listed down three random questions that Nidhi has given to me, and this is how I want to utilize the live. First question is, okay, what's the first question? Okay, what is your approach when a person is injured? My approach when a person is injured is quite simple, I guess. First thing first, I try to determine the clarity of what is the injury. Clarity is very important. Without clarity of what structure is injured, you can't treat anything. So first thing first, uh, my my approach begins with getting the clarity about what is injured. It can be a ligament, it can be a tendon, it can be a muscle, it can be degeneration of bones, or it can be combination of these things. Sometimes there is no structure involved, but person is still experiencing pain. In this scenario, my first thing is to understand what are the factors responsible for the pain, and this is how I begin things. Once I have complete clarity of the reasons behind pain and injury, I will begin my next part, and that is I will test out things that person can do even with an injury. Right? Let's, for example, someone comes to me um, with a broken tendon, or let's say a common diagnosis is scapular tendinosis or tendinitis. Very common problem that people faces, especially if they are into overhead activity. Let's say someone is a bowler or a thrower or a javelin or a discus athlete, or someone who rides up with their arms overhead for a long period of time, someone who travels in Mumbai metro trains. They are the ones who come to me with supraspinal tendinosis. The first thing I will do is I will see what extent is the injury. Is there just an inflammation, or is there any structural wear and tear in the tendon? Is there a complete tear of the tendon, etc., etc.? Are there any other surrounding structures involved? That's the first thing. After knowing that, I will test out different movements of the shoulder joint. Let's say I examine that. Okay, I will ask them random questions. I will see, I will ask them, maybe, can you lift your arms in front ways? Can you lift your arm in sideways? Can you scratch the back of your head? Can you scratch the lower back? I'll ask them random questions and I will see how they are doing, or I will see how they feel when they do this. And once they do this, what I do is I try to load the joint. I try to load the joint in the directions where they are confident. Let's say that they say that I can lift my arm pain free in sideways, or I can lift my arm pain free in front ways. I will load that joint by adding some weight. And once that is done, what I will do is I will try to find a way to get it inside. Or let's say that if I scratch my head, the first thing that is happening is shoulder getting over the head, right? Elbow is getting over. Is I will try to strengthen their flex the shoulder. So basically, I will break down the movement pattern which is painful to them. I will strengthen the pattern which they can do, and I will strengthen that in the range of motion which is pain free for them. And once I do this, I will slowly plan a progressive overload. I will either increase the repetitions, increase the frequency, increase the volume, or increase the intensity at which they are doing things. And automatically after a few weeks, when human body is ready, it will allow the range of motion to get better over a period of time. So this is how my plan begins basically. Clarity comes first, second is what they can do, and third is finding out ways to achieve what they can't do. As simple as that. I bet you won't find a simple program like this. This is the simplest things can be. So I hope you had to learn something from this live. I will catch you up soon in the next live. Thank you for watching.